Welcome to Archways Threads, a show focusing on the threads of family and recovery support services that help make up the tapestry of life in recovery. Join us as we share stories from peers and participants in the field and practice of peer recovery support and family support and strengthening. And now, your host, Archways CEO, Michelle Lennon.
Hi everyone, Michelle Lennon here, host of the Archways Threads podcast, and we are continuing our conversation with Carina Raya, and we hope that you have listened to the earlier episode and enjoy the rest of the series with her. Thank you.
But, the DEA agent that spoke at a prevention conference that I was at recently had shared, like, the overdose death rates in the United States right now, it's like 9/11 happening every 2 days. And we barely talk about it. And we're pulling back funding right now. And it's like I said, as an independent, I'm like, we got to get along to have solutions.
Mm-hmm.
And I love, like, what you were saying, like, this is about being solution focused, sharing a story with a purpose. And it's not about pushing an agenda other than let's make things better for people.
Yeah, that's my agenda, and I'm going to keep pushing.
Yeah, you know, right?
I'm glad that you brought up the statistic, though. So how overdose rates have gone down, and being a data focused person, I've recently written like a 50-page grant proposal for school, and I had to look into a lot of information about Long Point in New York City.
Oh yes,
yeah. So
Rivera's place. Yeah.
I could meet him. I would be so happy. You watch this? Hey.
I'll put in the video.
Yeah. So learning, the overdose rates went down, and that's because of harm reduction programming.
Yeah.
Like, that is what it is attributed to, because we started giving people Narcan, their syringe services programs. I mean, don't even get me started about certain services programs. So I was 18. I had never done heroin before in my entire life. I did not know how to know whether a syringe was clean or used or like whatever. Like I had probably never even seen a syringe in my life. Literally, the first time I ever used heroin, and somebody had a single wrap syringe, which, like, duh, you can like put it back in the package. But I was 18. It didn't occur to me. I didn't know people like lied or anything back then either. So this person who I knew had hepatitis, and he knew I knew, so he was like, "Cool, this is like a new syringe." And like gave me my first shot of heroin. Literally got hepatitis the first time I ever did. Okay, so, and it's like it blows my mind. Like back in my day, you couldn't go to a pharmacy even and buy syringes.
Yeah.
Like, people had to reuse them because there was no other option. And like, when people complain about saying, "Oh, if we don't give people syringes, they won't get checked," well, I think that's just the most ignorant thing I've ever heard. But I remember another great public health program that probably does not exist today is there was a telehealth thing where if you had hepatitis and you had gotten genotyped, you could have a telehealth appointment before Zoom, which is on the phone. And somebody was like, "Oh, you have Hep C. Great. I'm going to send you Maverick. And then you're going to call me every, like, I don't know, maybe 3 weeks or something until you're finished with it. You're going to get a blood test and tell me how it goes." I didn't have to pay. Like, it was awesome. And I didn't have hepatitis after having it for 10 years.
Wow. Wow.
Yeah. Public health programs. Gotta have them.
Yeah. Because people don't realize, like, I think about, I go back to the tieback. So for us, it was a community healthcare worker's salary, basically, that was on the particular funding source. And this particular individual also does alternative peer groups. So I want to say, like, we worked out our funding issues so that she did not lose her job, but we could have been in a different boat, and many centers are in a different boat where they, don't have any other rabbits to pull out of their hat, But, she works with, like, alternative peer groups, which are youth. And she does some individual casework, working with individuals in recovery. And I think about, if for just one position that, costs maybe $50,000-$60,000 a year to support, right? And the funding we were getting from the Healthcare Disparities Grant was like $41,000. So we patched her job together basically with multiple funding sources. And, when I think about the idea of getting rid of that position. To me, it's crazy to think it's saving money, because if we avoid one arrest by one, of one of those youth, if we avoid one hospitalization, one emergency room visit, one overdose, one case of hepatitis, like it pays for it 10 times over in some cases.
Is there any chance that I brought my computer with me and I wrote literally the numbers, how much New Hampshire can save in emergency department visits?
Oh, yeah. Yeah, Carina has some pretty startling statistics as part of the research she's done as a student. So you want to share some of the statistics?
Yeah. So you mentioned, when we take away somebody's salary, we think we're saving money. Or when we take away like a grant for a program, we think we're saving money. But that doesn't fully think through the entire chain of events from, the beginning to the end of somebody going through treatment. So let's see. Estimates from Premier Inc., the healthcare improvement company known to collaborate with HHS, state that an opioid-related emergency visit costs $1,264 per person. And when the patient gets admitted, so with complications like an infection, endocarditis, whatever, the costs rise to $15,763. So in Hillsborough County, that means you're looking at around $1.3 million in opioid-related emergency department visits alone every year. And that number jumps to a staggering $15.8 million if each patient were to get admitted with complications. So that means just in Hillsborough County, with the number of opioid-related emergency department visits that are reported through the New Hampshire opioid dashboard database, or it's actually the NHDMI, that every year between $1.3 and $15.8 million is spent on opioid-related emergency department visits.
Yeah.
So when we pay for programming, which is $40,000 for somebody's salary, okay, that's a fraction of that cost. And if that person keeps people out of the emergency room, we are saving huge amounts of money in public health dollars, whether that be, not to generalize, but a vast majority of people who are struggling with substance use disorder are on Medicaid. So that's a lot of Medicaid dollars.
Yeah.
Which can certainly go to a lot of other like health promotion programs when they're not, being tied up in emergency department visits.
Yeah. I think that, one of the things that's difficult is like it's hard to measure prevention, right? Because you can't measure what doesn't happen. Well, except we now have data from things like the BARC-10s that shows the rates of accessing these things goes down once they're connected to a recovery center.
I think some really like mind-blowing information about prevention, right? A big complaint about, people who use drugs is like, oh, we see like homeless drug addicts and it's like poisoning the community and like people don't feel safe to go outside and there's drug-related litter and like whatever. Which, sure, seeing people intoxicated in public and drug-related litter are legitimate concerns. Nobody likes that. Got it. So when we talk about prevention, there's a number that I keep, telling everyone. I'm like, hey, tell your friends. So On Point, New York City has 2 overdose prevention centers in East Harlem and Washington Heights. And in the first year, so 1 year, first year that they were open, the overdose prevention centers prevented 40,000 instances of public drug use. 40,000 instances of public drug use. And they collected over 400,000 pieces of hazardous drug-related litter that would have been in the community otherwise.
And were found in the parks before, which everybody was complaining about. And like, because I happened to see Sam Rivera at SAMHSA at a conference in Washington, and he was sharing like the parks have cleaned up because they're not leaving their trash there anymore.
Yeah. And as much as we think it's difficult to measure prevention, I think that there is really compelling evidence that something like an overdose prevention center does have the capability to measure the impact of prevention, and it's staggering.
Yeah. Sometimes it's difficult too, because I have found recently that sometimes the political whims overtake the data. That we can have the evidence right in front of us, but it takes, one person that's maybe lost a loved one, that's just very angry, that just wants everybody who uses drugs to be arrested, and there's been a conversation in our state, it's about mandatory minimums again. And, at first the rates that they were talking about, it was personal use, because, the intent is to stop fentanyl from coming in, stop dealers, but, one of the things that we tried to talk about is like, when somebody's driving all the way to Lawrence to pick up their stuff, they're not getting, just for them, they're going to pick up for their friends, you're not going to stop it by arresting one person and sending them to jail for 3 years. In that social network, somebody's going to pick it up. Now you've just created a second dealer in the community. And, sometimes like the follow through and the thinking, like you said, is not there. Like, where is this going to lead?
Right.
And if the underlying concerns are not addressed because there's no mental health system to turn to, or there's no way to access that trauma counseling to deal with like the underlying reason why somebody may have started medicating themselves, because I often think that self-medication is another reason.
Huge.
Yeah. And, or can't access, like my husband's recovery would not have stabilized except that he was able to access care at Dartmouth Hitchcock and go through numerous surgeries. And at first it was because of Medicaid. And then, eventually on private insurance, because I work full time now and I have insurance. He's on my insurance, and, and for him, he's actually working now. And I look at that, and he could have been somebody that was on disability for life, but because of access to these programs, like and I do think like people sometimes misunderstand, or they have this impression that people access these resources and then they stay dependent on them. But all of the goals,
Not true.
yeah, there you go, right? Not true at all. But like vocational rehab, I mean, that full program exists to help people
They
find,
from high school now.
yeah,
They're
finding purpose,
the MD.
yeah, and getting back to work, right?
Because let me tell you, my ability to pay back what I received in Social Security is a lot higher when I have an MD than compared to when I didn't.
Yeah,
Yes, it's worth it.
right.
But I want to mention, how the political whims and things tend to get like confused, right? So New Hampshire has made it clear that they're a abstinence first state, which I think is super ironic because like liquor stores exist.
And they welcome you at our border.
Yeah, so that's huge, giant barns filled with booze is not abstinence first of all. But so that's a reason why a lot of the political will is not behind something like an overdose prevention center, because they're like, oh, well, it's condoning drug use, like a liquor store thing. So what they have found is when people are engaged and using an overdose prevention center, so public drug use decreases, drug-related litter decreases, transmission of HIV and Hep C decreases, and you know what else decreases?
Substance use.
Yeah, substance use.
Yeah.
Over time, it is shown that providing people more services and a safe place to use drugs makes them use drugs less. So it is entirely an abstinence-based policy. Taking away drugs and preventing people from using drugs or accessing like drugs or drug paraphernalia does not like equate with abstinence.
Right.
It equates with desperation and people, increased crime or increased diseases and sickness and trauma, and like people less likely to be able to break that cycle of chaotic drug use. But providing people with services and people they can trust and positive relationships and a lack of judgment and, releasing them from stigma allows them to move forward in their life. It is abstinence based.
Yeah. And I think like when we talk about harm reduction, like if you go, to the very basis of what harm reduction is, like had my motorcycle license, had a motorcycle, like I would wear a helmet, to reduce harm. And I crashed 3 times. So
We don't have a law
let me
or
tell you.
seatbelt law.
I know. We go. Powered after my choice, right? And
Right, by choice. So shouldn't we have a choice to be able to utilize an overdose prevention center?
now there you go, right? or just to be able to access new and unused needles. We had different pharmacists in our region who just took it upon themselves to decide not to sell needles to people that didn't have a prescription from a doctor. And when that happened, like you said, desperation takes root. We had a participant who shared with us, he actually ripped a needle disposal unit off the wall of a public bathroom and took it home.
Yeah.
And
Which makes perfect sense. Because they're probably only been used once.
Yeah.
And like they're probably not in bad shape. So I don't know if they can probably bleach them, sure.
right. Which is horrific from a public health standpoint.
It's horrific. But I also want to point out because I think people who have engaged in chaotic drug use do have a lot of ingenuity.
Right?
That is a lot of ingenuity right there. And like when we see people enter recovery, like that ingenuity doesn't disappear.
Right.
We can take the skills that people have who have suffered with, drug use and mental health issues and channel that into something positive and creative. Like there's a reason to keep people who have used drugs alive and to you have them be productive in society because there are important characteristics that they embody.
Well, because the skills are the skills, right? So if you have these really awesome problem solving skills that you learn to use in life, let's use them for good. Yeah, that's awesome. Just thinking about harm reduction, you picked up one of the T-shirts that we had out front that said the war on drugs. Yeah. And I'll give a shout out to Robert Ashford for this one because I got it from him. But one of the things, so I was a history major originally.
Right.
My first degree from UMass was actually in history with a minor in women's studies, and I go back and I think about historically how we got here. And of course, the war on drugs was really a war on people. We know this historically, contextually, with the issues in Maryland and in different places, really rooted in racism and a lot of prejudice against poverty. And it was really a time where we were really washed over with community programming to think, you could just say no to drugs and that addiction really wasn't a thing. It was all a choice, and, thinking about the brain as an organ was something we generally don't do. We tend to think the brain is the seat of the mind and the will and that everything is a choice. And it was Lindy Keller years ago, who she's retired now from DHHS. She had worked she had worked she is lovely. And she had done a training on addiction in the family, which was life-changing for me. Probably 20 years ago now. But I was doing family support work and my home visiting caseload was working with young women affected by both poverty and under the age of 21 and pregnant. And my caseload slowly was basically all young women who use drugs. And my boss at the time sent me to a ton of training. And one of the trainings I went to, Lindy Keller had done this training. And one of the things that she had said about addiction to certain substances was that the brain as an organ has way more power over us than we think. It's not an act of the will that we breathe. And I thought about that. And she compared the compulsion to substances because, she talks about the definition of addiction. The addiction on its own, you can find it, and define as that chronic compulsion to do something regardless of being very conscious of negative circumstances. And talked about like the primitive part of our brain and how a lot of our automatic functions are rooted there. And that's part of the brain that's affected. I mean, we talk about dopamine uptake, cited some things like that about the pleasure principle and all of that. But like that compulsion to breathe. And use the example of if your head was held underwater and you were told, not to take a breath. Like, logically, you can know that if you take the breath, you're going to drown, right? But you're going to take that breath because your compulsion from your brain is so incredibly strong to inhale long before you would suffer brain damage.
Yeah.
And you still do it.
I mean, let's see. I think you phrased compulsion as like the desire to go through the behavior regardless of negative consequences.
Yeah.
Right. So that hit me. So another reason why, like, oh, people who have used drugs, like how they can, have a positive place in society. Right. I know that starting a journey to med school at 30 years old is friggin' crazy. Like, I'm literally probably giving up ever having like a family or really making like long-term friends. Like, I'm moving around all the time and I'm accruing like massive debt. Like, every time I have to like sign my MPN, it's like, you're going to have like my loans are 10%, but I'm doing it even though I know there's negative consequences.
Mhm.
So being able to, when you're not engaged in chaotic drug use, having that ability to do the thing, which sometimes is the right thing. Like, often doing the right thing has negative consequences. Standing up against people who are being racist or discriminatory is the right thing. And does it have negative consequences? Yes, it does. A lot. So when we talk about people who have used drugs, again, another positive thing is like, okay, well, if you're compelled to do drugs, like, that's not great. But if you're compelled to do other things that may have negative consequences, but maybe it's the right thing, great.
That's so interesting.
I love to create a positive spin on things.
Well, and the thing is, you have the ability to count the cost, you know, count the cost, and it's more worth it to you, to pursue this career.
And, when I was 18, it was more worth it for me to like use heroin than it was to not.
Yeah.
And I couldn't articulate why at the time. I don't necessarily I'm not of the mind where I regret any of my behavior. I don't think I made the wrong choices then.
Yeah.
Like,
That's hard for people to accept. But I will tell you, working with youth, we do not take youth on this journey of a mad rush to abstinence because we know now, because of the science and because of what we know now about studies on early childhood trauma or traumatic backgrounds or different incidences that kids have gone through, that usually there is a reason and that the behavior is communicating something, and getting to the root of what is it communicating becomes a little bit of the goal.
Yeah.
And I'll never forget, because like the seven challenges, which is one of the evidence-based programs that we use, has a journaling activity that comes with it.
Nice.
And
that's so important.
And it's not like, I don't talk to the youth like this, our coaches do, and then there's a component of the journaling where it's like back and forth dialogue, but it's not done face to face. It's all done in writing.
That's awesome.
And we're really good about not judging, what the youth share. But when you have somebody, and it could be a youth, it could be anybody really, who shares something, we usually ask a question. So one of the questions on the BARC 10s or through most of our program is, have you used the substance that you're trying to abstain from? And I say that because people don't quit everything. I think that's another myth of recovery, right? That you have to quit everything. Like, some people can't use opiates, but they're fine to have a drink here and there, So with the youth, we kind of treat it the same way and ask the questions like, have you used the substance that you've been trying to abstain from since you last wrote? And if they say yes, I smoked, like, they talk in an informal register, right? So it's like, yeah, I smoked weed with like 3 of my friends last week, and then again, like, I snuck out and was like on the roof or something, like, so, respond some way like that. We don't sit there and condemn them for that behavior. We'll ask the question, what did you get out of that? When you have a young person say, it stopped me from killing myself that night.
Yeah.
How do you say it was the wrong choice to make?
No, I totally agree. And I think with young people, how you said, like, you don't do like a hard, fast, like, journey to abstinence. That's really smart. But I think it can be hard for people to do because, like, with young people, the results are not necessarily something that you can see for many years.
Yeah.
For example, when I was in high school, when I was a senior, I had already turned 18. I moved out of my mom's house and I was living with my boyfriend and we were doing heroin and everything. So I had stopped kind of coming to school all the time. And my principal was like, what's going on? I was like, my boyfriend has like mental health issues. He doesn't always want to drive me to school. Like, we don't have any money. He does drugs. Like, I'm struggling. Like, I don't know what to do. And he was like, okay, well, if you come to school 3 days a week and then you do 3 hours of class and then you sit in the cafeteria and pick up trash for the rest of the day, I will pay you to pick up the trash.
Wow.
Little did I know. So the woman who watched the cafeteria, she was like the attendant or whatever, was in recovery.
Mm.
She was in AA. And I would hang out with her all day.
Mm.
And I did not stop using drugs at that time. And I did not, get into recovery for many years. But she never judged me for that, for one. And for two, she maintained this like non-judgmental curiosity, asking about how I was or like what I was interested in and just having like a, genuine conversation with me. And I looked forward to that. So it made me go to school. I graduated, I got my diploma.
And huge impact on you. Like, yeah, you can imagine.
And I still think back, like, I don't remember exactly the things this woman had said to me, but I remember the time that she took to connect with me.
Yeah.
And like that mattered a lot. And it has not ever stopped mattering.
Thank you for listening to Archways Threads. If there is a topic you'd like to see us cover, email us at podcast@archwaysnh.org or call us at 603-960-2128. Visit our website at archwaysnh.org to learn more about the Archways family of recovery and family resource centers.